Here, Marion Rhodes, the Director of Pharmacy at St. Joseph Medical Center in Reading, Pennsylvania. Marion will review what constitutes hazardous waste and where to dispose of it. Her expertise in this area has earned her the fabulous title of Trash Queen from her peers in Pennsylvania. And Marion will be followed by Cheryl Walmsley, the Pharmacy Clinical Coordinator at St. Joseph, who will talk about how to communicate this important information to everyone at your hospital. So I am going to make Marion the presenter here. And give her the floor. And Marion, be sure to click the Show My Screen button, and the floor is yours.
Thank you, Lynn, for the introduction. This afternoon, we'll talk about managing pharmaceutical waste. Here at St. Joseph Medical Center in Reading, we've worked on this project for over 4 years, and I do believe we still have a ways to go. We're only handling one part of our pharmaceutical waste, the hazardous waste, right now. I'd like to start with a disclaimer that the information that we're giving in this presentation today conforms to Pennsylvania and local regulations here in our county. Other states may have more stringent rules, and really it's up to every individual to check their local and state regulations when comparing their requirements to this presentation. It's also important to remember that both the transporter and the receiving facility may also have regulations that vary from your state if the hazardous waste is going out of state for disposal. As it is here in Pennsylvania, we send our hazardous waste to New Jersey for disposal. What are the reasons for a pharmaceutical waste program? Mainly there are 2 reasons. One is the environment. As everyone knows, there's been a lot in national newspapers and publications regarding the amount of pharmaceuticals that have been found in the water streams. Also, there are regulations surrounding pharmaceutical waste. There are basically 3 elements of a pharmaceutical waste program. The first is the characterization of the waste, and basically what happens here is you need to download your formulary from your purchasing records and have it categorized by someone who can tell you the classes of hazardous waste that you may have. Here at St. Joe's, we have approximately 3,000 items on our formulary, and just to give you an idea from our categorization, I believe there were about 78 products that were considered hazardous waste when we did our initial categorization. The second part is the waste collection and segregation, and the third and final is the waste transportation and disposal. The hospital is basically the generator of the waste and is responsible for managing the waste from cradle to grave. So that means that from the time you take the product into your institution until the time it is incinerated, you have to make sure that it has followed through the correct chain of command, and that you maintain the manifests, which are the documents that indicate that it did reach the incineration plant and that it was disposed of appropriately. That is something when the DEP comes in and does an audit, that's one of the first things that they are looking for, is that the manifest for the hazardous waste that has left is back in the facility and completed appropriately. We here in Reading have had 2 local visits from our DEP since 2007. The concerns regarding the hazardous waste, first was the U.S. Geological Water Survey was conducted and found that organic waste contaminants were in 80% of the streams tested. 33% of the organic waste contaminants were pharmaceuticals found in Minnesota. Hence, Minnesota has one of the more stringent rules regarding hazardous waste. There have been EPA regulatory visits. In October 2007, 4 hospitals were visited unannounced by EPA Region 1 in the Boston area, and warnings were issued, and a revisit in the first quarter of 2008, they were looking for waste implementation plans. Here in Pennsylvania, we're in EPA Region 3. I have heard recently that there's been a lot of activity in the New York area. The Joint Commission also is the regulatory body for accreditation, and they have standards involving medication management, the environment of care, and leadership that surround the topic of hazardous waste. There are many agencies involved with hazardous waste. The EPA, of course, is involved, the Department of Transportation, because many times the waste is going over our highways and crossing state lines, the Joint Commission, and the Drug Enforcement Agency, because there are controlled substances that are involved with hazardous waste, and local and state regulators. The law that governs hazardous waste is not a new law. It's the Resource Conservation and Recovery Act of 1976, and basically this act controls the management and disposal of hazardous waste by the healthcare industry. Its enforcement is through the EPA, and it defines hazardous waste as items so damaging that they must be set aside for special disposal and cannot be sent down the sewer or dumped in a landfill. There are two types of hazardous waste categories. There are listed wastes and there are characteristic wastes. In the listed waste, the two that are primarily found in the healthcare setting are the P-listed waste and the U-listed waste. The F and K are primarily found in industry. The characteristic wastes exhibit hazardous properties, and they fall into one of the four categories of ignitability, being corrosive, reactive, or toxic to the environment. The P-listed waste, a drug is placed on this list if the oral lethal dose is 50 milligrams per kilogram or less, the LD50. And again, that's the amount of material when given at once causes the death of 50% of a group of animals. And as you can see, the list for P-listed waste is not very long. Arsenic trioxide is a chemo agent. Epinephrine, there was a memo sent out by the EPA in October 2007 which exempted epinephrine salts, and here in Pennsylvania we do follow that federal regulation where epinephrine salts are exempt from the hazardous waste standards. Nicotine, nitroglycerin, phentermine, physostigmine, and warfarin. There are two necessary conditions to be P-listed waste. The discarded drug waste must contain the sole ingredient that appears on the P list. Therefore, if the ingredient is used for any other function, such as as a preservative or a mobilizing agent, it's not considered a hazardous waste according to this first condition. And it has to be used for its intended purpose. And again, the second condition refers to the portion of the drug or dispensing instruments that have not been given to the patient and needs to be discarded. Examples of P-listed waste would be unit dose Coumadin tablets and packaging, the patches and packaging of nicotine patches, and the patches and packaging of nitroglycerin patches. Physostigmine vials and all syringes used to administer the drug. And again, it's when the physostigmine is drawn up in the syringe and you may get it back in the pharmacy and it hasn't been administered, the whole thing goes into the hazardous waste. And why the patches are on this list is because of the amount of drugs that they contain is so much more that 95% of the drug is left in the patches, and their limits exceed what is acceptable as hazardous waste. And again, there are no exclusions for dilutions or concentrations. If you try to dilute a P-listed waste, then you're just making more P-listed waste for disposal. Empty containers of P-listed waste would be considered RCRA empty if they've been triple rinsed and the rinse aid is handled as hazardous waste. So since that's very impractical in the hospital setting, all the containers are managed as hazardous waste regardless of whether or not all of the contents are removed. So that's why the unit dose packaging for Coumadin and the patch packaging is going out as hazardous waste. The U-listed waste, the list grows much larger, and on this list I have highlighted in the teal color the items that are listed on our formulary. When we first started looking at this, we made some changes to our formulary so that, for instance, we carried lindane for lice here at St. Joe's, and we actually switched that product when we saw it was hazardous waste to try to cut down on the amount of hazardous waste we would be shipping out of here. An excellent resource, which I actually got this table from, is the 10-step blueprint for healthcare facilities in the United States. And I would encourage anyone who hasn't seen it to Google that, and you will get the website, and it's pretty comprehensive on how to do the calculations of, for instance, thimerosal or in vaccines, or even the M-creasols in the human insulin, to know if they hit the hazardous limits or not. U-listed waste, they have the same two characteristics, and there's no concentration limit or dilution exclusion. They have to be the sole active ingredient, and they have to be used for their intended purpose. However, the difference with U-listed waste is what constitutes an empty container. An empty container of U-listed waste, all of the contents have been removed by normal means, so your bag is virtually empty or contains no more than 3% by weight. And if both of these criteria are not met, then the container must be managed as hazardous waste. If both criteria are met, they can be disposed of as regulated medical waste. When you get into characteristic hazardous waste, one of the items is their ability to be ignited. And many drug formulations fall into this category because they have 24% or more of alcohol by volume and have a flash point of less than 140 degrees Fahrenheit or 60 degrees centigrade. Two items that we carry here at our institution that fall into this is erythromycin 2% gel and Taxol injection. You can also have liquid drug formulations that contain less than 24% alcohol that still has the flash point of less than 140 degrees or 60 degrees centigrade. And one of the items that would fall into this is flexible collodion, which they actually use here in our operating room. Oxidizers are materials that readily supply oxygen to a reaction in the absence of air, also fall into this category, and as you can see, that includes amyl nitrite inhalers, silver nitrate applicators, and bulk chemicals such as potassium permanganate. One of the things that we do here with our oxidizers, we have quart hazardous waste bottles which we dispense with our silver nitrate applicators, because one of the things we try to do is to keep our oxidizers separated from our other agents so that they don't all be considered oxidized agents. And the last area are flammable aerosol propellants, and that includes the various pressurized inhalers. As far as being corrosive, that would be any waste with a pH of less than or equal to 2 or greater than or equal to 12.5. And again, things we would use in the pharmacy would be strong acids such as glacial acetic acid or strong bases such as sodium hydroxide. In the reactivity category, they would be wastes that are unstable under normal conditions. And the only drug that really fits this category is nitroglycerin, but there is an exclusion for medicinal nitroglycerin, so this does not apply. The exception, of course, though, are the patches, which are black bucket waste, and the wrappings that they would come in. As far as toxic agents, the list that's available out there in all of the publications lists at least 40 chemicals in this list. And what we actually did is we took from that 40 chemicals, the chemicals that we have in our institution that are on that list. The barium does not include used barium, and I'm actually in the process right now. We use barium products from Bracco Diagnostics, and it's my understanding that they have some information that shows that their products fall below this regulatory level for not having to go out as hazardous waste. The multivitamin preparations, as you can see, have the cadmium, chromium, and selenium. and you may have some of the selenium products for dandruff shampoos. And then silver, the silver sulfadiazine cream, and the big one, of course, is the M-creosol, which is found as the preservative in the human insulin. The other important thing to remember is contaminated personal protective equipment and spill materials. If gloves or gowns are soiled with P-listed or U-listed waste, it must be managed as hazardous waste. If it doesn't come in contact with the gowns or any of the protective equipment, then you still can discard those in your trace chemotherapy waste or in the trash as solid waste if it's a non-chemo agent. There are 3 controlled substances that need to be handled as hazardous waste: chloral hydrate, peraldehyde, and phentyramine. All other controlled substance waste still requires 2 witnesses in drain disposal, and there is some controversy around this regarding putting the controlled substances down the drain. However, that still is the current stance of the DEA for drain disposal. Here at St. Joe's, we did have chloral hydrate on our formulary, and it was used infrequently, so we made the decision to remove it from formulary so we wouldn't have to deal with it as a hazardous waste. And then again, trace versus hazardous chemotherapy waste. If you have a visit from the DEP, this is one of the low-hanging fruits that they come in looking at, because many people are still putting their chemo vials and chemo waste into yellow buckets. So for it to be considered trace chemo waste and go in the yellow bucket, they have to be RCRA empty vials, which means they can't be P-listed waste, and they must be U-listed waste, and they must contain less than 3% by weight in those vials. The syringes, IV bags, and tubing, and then the gowns, gloves, wipes, and other paraphernalia associated with routine handling, preparation, and administration of chemo. If they have not been contaminated with hazardous waste, they can still go into the yellow trace chemotherapy waste. And as you can see, the hazardous chemo waste, the list is not very long, and again, it's because the law was written in 1976, and there have been many drugs. The drug list has not been updated. Here at St. Joe's, we have decided to be good stewards of the environment and treat all of our chemo waste as hazardous waste and not just stick to this list, because I think it'll be only a matter of time before that list is updated to include that. Then the non-RCRA hazardous waste, we have, as you can see, again, some newer chemotherapy agents, and bevacizumab, which is a monoclonal antibody. After you go through all of the characterization for the hazardous waste, the next thing the facility has to determine is its generator status. If you become, there's 3 types of generator status. You can be a large quantity generator, a small quantity generator, or a conditionally exempt small generator. And as you can see, the amount of P-listed waste is really where your generator status comes to. And as long as you do not accumulate more than 2.2 pounds, if it's less than 2.2 pounds of hazardous waste or P-listed waste per month, you can qualify as a small quantity generator. There are several common EPA violations. You could have hazardous waste determinations not being done or incorrect. You are responsible for making sure that the items that you do have on your formulary are appropriately categorized. We actually send the NDC numbers out as we add new drugs, since our categorization was done, to the plant that incinerates the hazardous waste to make sure it does not fall under the classification of hazardous waste. You have to make sure that it's labeled appropriately. There are specific labels that have to go on your waste indicating that the waste is hazardous and that it's pharmaceutical waste, and your name and address of your generator, when it was put into satellite accumulation and when it was put into storage accumulation. Another EPA violation could be the improper disposal of chemo drugs, inadequate training of employees in hazardous waste management, not conducting proper weekly inspections of your hazardous waste accumulation storage area, no or inadequate hazardous waste manifests. Again, that's the piece of paper that you get when you send it out to the incinerator. It's the responsibility to make sure that that copy comes back in a couple weeks to you, indicating that all that you had sent out was incinerated appropriately. Improper management of expired pharmaceuticals. This actually was an area of discussion with my local, the local EPA office here when they came out on how we handle expired drugs, and we do not send any of those back through the reverse distributor, because one of the issues is you do not know if you're going to get credit for it and it's going to actually go back to the vendor. And then another violation could be a lack of an emergency contingency plan. There are 3 standards that are affected by hazardous waste from a Joint Commission standpoint. The first is the Medication Management Standard, element of Performance 4 for 010103, states that the hospital minimizes risks associated with managing hazardous medications. The second is in the Environment of Care chapter, and again, the hospital minimizes risks associated with disposing hazardous medications. And the last is in the Leadership chapter, that the hospital provides care, treatment, and services in accordance with licensure requirement laws, rules, and regulations. The storage requirements are that the black buckets must be kept closed at all times because they contain hazardous waste. And if an area generates a large quantity of black bucket waste, the buckets can be kept in the soiled utility room instead of in the medication room. One of the big challenges for us after we categorized the drugs was how do we identify the waste and make this simple for our nursing staff. So the next couple slides are going to show some of the visual cues we have used to identify our waste and some of the labeling that we did. The Pyxis QV pockets have a static clean, which states to dispose of the contents in black bucket waste. Here's an example of, these are what we call dog dishes to keep the container stable on top of the Pyxis med station. And again, the top must be kept closed after each use. And the containers themselves, the flaps on the top do close. They don't, it's pretty hard to keep them open. We didn't use the spin tops. We used the flap tops, which it's pretty impossible. They'd have to prop them open to keep them open. For areas that generate a large amount of black bucket waste, for instance, in the pharmacy, we have closure devices with a foot pedal so that once your foot comes off the pedal, the top closes automatically and you don't have to keep going after people to keep the tops closed. And then this is an example of how our pharmacy department, our pick bins, our unit dose pick bins are labeled so that the technician knows their hazardous waste for loading into Pyxis, making sure that a cling gets attached. We also use these HW stickers on all bulk meds that might be hazardous waste when we send them to the floor. The hazardous waste stickers are put on when we receive our order. Those stickers also appear with our shelf tags so that there's many visual reminders in the pharmacy that an item is hazardous waste. One can also set up a Pyxis clinical data category. You would log into Pyxis as usual, choose your patient, choose your medication, and at the medication level you could have an alert message that will pop up and the person who's removing the medication will be required to acknowledge it. And it will indicate that the drug and packaging or drug without the packaging needs to be disposed of in the black bucket. For those on the line that might be have Meditech as their information system, how we proceeded to identify our drugs in Meditech was we have a customer-defined screen, which you can see at the bottom in green, that has the hazardous drug list. So we put the codes there, and then we also put the responses for the drug numeric code. So as you can see in the first one, warfarin is a P-listed med, and again the arrow shows it's a P001. And the reason we did this is we wanted to have a means in which to have output to labels and to medication administration records. And as you can see on the medication administration record, I have to apologize for the quality of this. We tried to scan it to get a better quality, but the original copy was very clean, but for some reason the scan is a little choppy. But as you can see, the P-listed waste for the nurse says to dispose of the contents and packaging in the black bucket waste container, which she's always taking this to the bedside. And with the U-listed waste, it has to discard any unused drugs in the black bucket container. This will move forward when we go to EMAR. It will pop up at the time when she would be administering the med. Here's our syringe labels and the outside bag. As you can see, we have an HWP if it is a P-listed waste. Here's an example of P and U-listed waste. On the left is the physostigmine diluted. It would have an HWP, which would be the alert to the nurse that it's both the bag and the drug. And on the right side is a U-listed waste. If it was just one of the other waste categories, the characteristic waste, it would just have an HP on there with the asterisk, and it would not list the P or the U. This is our accumulation storage shed. After we went live with the program, we did a pilot on our progressive care unit, our step-down unit in the hospital, because they had a lot of the patches. To see what kind of waste would be generated, we did one unit for a month, and then we took each unit thereafter. Each month we did the education and rolled it out. One of the things we learned was as the buckets became filled, because it's a costly process to send this out, we needed a place to accumulate that. So we actually purchased this accumulation storage shed, and our black buckets are stored on site for up to 180 days because at this point in time we're still considered a small quantity generator status. If you were a large quantity generator, you would be able to only store the containers for less than 90 days, and there is no time limit on the conditionally exempt that I'm aware of. And this is the inside. We have a table there, and the vendor that we use comes in and takes the buckets and sorts it for transport out of the facility. And all that sorting is done by them at this point in time on the inside. And this is the thing you must do the weekly inspections of. There on the table we have clipboards where we go in and we make sure everything has the proper labels on it every week and so forth. One other thing which leads to your local EPA person coming out, before these accumulation storage sheds can go into operation, they must come out and give their blessing on the storage shed before you can start utilizing it. And of course, when we had to do this back in October, we ended up with a 2-hour visit on site regarding our hazardous waste program. Again, one of the best, I have listed on the references the memorandum for the epinephrine, and also again that 10-step blueprint for healthcare facilities in the United States is really an excellent reference and a great starting point and very easy to follow. At this point in time, I will turn the program over to Cheryl, and she will show how we took most of these items that we've done in this hazardous waste program and have put them on our online formulary.
Okay, just a changing of the guards here real quick. As Marion said, my name is Cheryl Walmsley. I'm the pharmacy clinical coordinator, and my job was to see how we could incorporate this hazardous waste information into our online formulary and pharmacy resource site obviously using FormWeb, and how we could have one place for this information for the hospital staff to reference. Let's see if this works here. So here is our FormWeb website. St. Joseph Medical Center, we are a 211 community bed hospital. So the way that I've set the Form website up, as we were developing our hazardous waste program, I actually at that time had asked FormWeb to redo my buttons because I needed you can see right here, a hazardous waste button. This is, when I click on this, you can see this is one place where I have been able to keep all of the information in one central location, because it's really, as you can see from Marion's presentation, it is really difficult to try to remember everything included in there. Even sometimes now, I'm always referencing back to some of these tables because it is just really overwhelming, the amount of information. So the way that I've set this up is under that button, Hazardous Waste Management, I have our categorizations, our Pharmaceutical Hazardous Waste Policy, and then a few resources. Again, this is relatively new for us, so I'm sure I'll be adding more and more to this as the time goes on. But when we click on P-listed waste here, and a lot of this information will look familiar from Marion's presentation because it's actually a lot of cut and copy. But this is a list of our P-listed waste. Quick information on how to dispose of the P-listed waste. So, for example, as Marion talked about, the product is the sole active ingredient. The chemical in question is the only one which performs the intended action. Also here on this summary page, this is basically a summary page, are examples of P-listed waste, and then what to do if there's contaminated personal protective equipment and spill materials. So basically, it's kind of Marion's presentation on P-listed waste in one summary sheet. It's a nice reference sheet. So if you go back, when you click on U-listed waste, it's basically set up the same way. We have our highlighted drugs, and I think this, I believe we still have some chloral hydrate floating around here or there. We haven't totally removed it from formulary, but we're working on that. But again, here it talks about the disposal of U-listed waste, and so we have a summary here on no more than 3% of the weight remains, and again, what to do about contaminated personal protective equipment and spill materials if it is a U-listed waste. So again, this is just a nice summary of all the information on U-listed waste, plus it also highlights for the hospital staff which drugs are on our formulary. Next, the toxic characteristic waste. Again, this is, again, set up very similar, same type of information. Goes over characteristic waste and personal protective equipment, and also it talks about here, how do you know that the personal protective equipment has been contaminated? Is shiny sheen, change in color, change in texture or feel, visual evidence such as seeing the contaminant on the PPE. And again, regulated medical waste and hazardous waste. So we tried to provide examples here, and again, just as a nice one-page reference sheet. Next, I like to use formulary just in general to post policies specific to the pharmacy. I mean, not our whole entire policy manual, because we do have that on our intranet, on our hospital intranet website, but things that may be specific to a drug, specific to, for for this example, pharmaceutical hazardous waste. So I have a link here to our specific policy on hazardous waste, and it talks a lot about a lot of the information that Marion presented in her presentation. And then, of course, resources, because Marion has done all the education for hospital staff, for the nurses. I included her presentation on this as a reference because, you know, it's very, there's just so much information. So I'm not going to go through this because this is basically what she just presented. We have a pharmaceutical waste guide. So this is something that actually, I believe, is included in our policy as a reference, but Marion had typed this up talking about all intact dosage forms, non-intact dosage forms of controlled substances, all non-controlled substances. So basically, it's a summary of pharmaceutical waste. It's a guide for the staff. And then, of course, we have to have frequently asked questions. So as Marion has done her education, there have been questions that have come back. For example, these are just a few of the questions that we've had. And so if one person has a question, obviously there probably will be multiple people with the same question. Do nitro paste and nitroglycerin tablets and capsules have to go in the black bucket? The response there is no, they do not. This was a very important question. Does the paper cup that the warfarin is put into to give to the patient have to be disposed of as hazardous waste? And the response there is yes. And the recommendation is to give the patient the drug into their hand right out of the unit dose packaging to cut down from using those paper cups and having to then dispose of them as hazardous waste. The third question, does the syringe that the insulin is drawn up in have to be discarded as hazardous waste? The answer there is no. This came across through our sort. Actually, Marion and our vendor had found fentanyl duragesic patches. So we put on the question, are fentanyl duragesic patches and their packaging considered hazardous waste? Because they, you know, they see the nitroglycerin and the nicotine. And the answer there is no. Duragesic must be disposed by cutting in half and placing in the sharps container with a witness. That's our policy on disposal of fentanyl patches. And the packaging can be disposed in the general trash. So again, here's just, again, references for staff of some frequently asked questions. If one person has a question, then there will probably be multiple people with the same question. Then the other place I'd like to point you to is we have added this also to, I'm just going to refresh our page here to take you back to the beginning. We have added it on the left-hand side here as, you know, we do have a high alert, therapeutic interchange, restricted drug, black box warning, look-alike, sound-alike, education, do not crush, do not tube, and we've added hazardous waste. I was very happy when FormWeb added an extra category because I thought this was going to be perfect, the perfect place to use this. And so when you click on hazardous waste, we have a list of all of our drugs on formulary that I have linked as hazardous waste. So just to show you how I've used some of those, some of the FormWeb features to kind of communicate the information on the hazardous waste, I'll click on a couple drugs here. First, chloral hydrate. And so I used the pop-up box here. And with chloral hydrate, because it is a U-listed waste, I actually calculated out what the remaining quantity would have to be greater than, because remember it's greater than 3% by weight. So if greater than 15 milligrams remains, hazardous waste disposed in black bucket. When you click OK, it brings up our chlorohydrate. Because we only carry one strength of chlorohydrate, I'm able to actually calculate that dose, and so it's right there for the nurses. One of the things that it says here, hazardous waste, and again, it's the same warning. When you click on that, it actually references back to that you listed waste table. So it will tell the nurse or pharmacist or whoever how to dispose of you listed waste. So if we go back to the hazardous waste button, one of the other drugs that I'd like to show you is Coumadin. So if you scan down here, down to warfarin, you click on warfarin. And again, I've put in there, remember, warfarin's a P-listed waste, so I've put in all tablets and packaging are hazardous waste, dispose in black bucket. Again, it's just another warning for how the drug and the packaging should be disposed. Sometimes it's confusion, does the drug and the packaging, or just the packaging, or just the drug, or and when you click on that, again, it's set up the same way. It links you right to the P-listed waste. Okay. Another drug I'd like to show you is a lot of people don't think about the inhalers. And as Marion had stated in her presentation, I clicked on fluticasone. Inhaler canisters, because of the propellant, are considered hazardous waste, disposed in black bucket. Now, I put on here inhaler canisters because the actual device that the canister sits in can be disposed of in the regular trash. And when we started our program, the whole inhaler was being thrown in the hazardous waste, and it was really increasing our waste. And so that obviously increases costs. So when you click on this, hazardous waste, inhaler canisters, dispose in black bucket, it'll take you to the toxic characteristic hazardous waste. One of the other drugs I wanted to show you was, Marion had talked about erythromycin topical gel, contains alcohol, hazardous waste, dispose in black bucket. So it's sometimes difficult because erythromycin is, I actually broke erythromycin out as a topical because we also have oral erythromycin, and those are not considered hazardous waste. It's sometimes difficult to break out, when you have a generic drug, the different formulations. The reason this is hazardous waste is because it contains alcohol. So I actually put contains alcohol in there instead of, I didn't want people thinking that it's erythromycin, and the erythromycin is what's the hazardous waste. And so when you click on that, it actually, again, takes you back to the toxic characteristic hazardous waste. So let me go back here. And one of the other drugs that I wanted to show you was nitroglycerin. Again, here's a reminder that all patches and patch packaging are hazardous waste, disposed in black bucket. When you hit OK, again, it's all set up. This is where I was talking about, because we have different formulations, it tends to get a little confusing, but we've incorporated the hazardous waste right in there. You can see our education link, or do not crush, do not tube. It's all right in there with that. And when you click on it, it takes you to the P-listed waste, as nitroglycerin is a P-listed waste. So that's basically how we have incorporated this whole hazardous waste program. And it's actually funny because as I do occasional rounding on the nursing unit floors, and even from physicians, I have questions about, I can't believe my multivitamin is hazardous waste. You mean the multivitamin I take every day is hazardous? How can a multivitamin be hazardous waste? And so I have to kind of go through the education and point them to the right information. But it's easy to know right where the information is using FormWeb. I think that's pretty much it, Lauren.
Sure. Thank you. I think what we'll do is let people ask questions now. You've put a lot of good stuff out there, and we've had some people already use their toolbox question area to type some in. And so I'm going to kick it off by telling you, one person had asked, is it possible to get copies of the PowerPoint presentation? And the answer is yes. You will get the slides from the presentation in your handouts. And also, as we mentioned earlier, this is being recorded, so you would be able to watch this session again with the audio and the video. So that's a good thing. And for people who do type their questions in, these questions, a record is kept of them as well that can be part of what you receive afterwards. So we actually have two ways people can ask questions. The first is to type your question into the question area, and we'll read it aloud and let Marion and Cheryl field it. And the other would be to raise your hand, and we can unmute you and let you talk. So because we have quite a few people on the call today, it's going to be a little easier to take the questions that are typed. But if you do have one that you would just rather speak, raise your hand. We'll see. We're doing very well with our time, so we'll just kind of see how that goes. I'm going to go back up to a question that got asked before this even started. Misty Vo had asked, how are facilities addressing waste of controlled substances? What about the residual that may be left in an infusion bag and or tubing? So would either of you like to address that?
This is Marion. At our facility, we still send it down the drain with 2 witnesses required. And I know there's still a lot of controversy out there, and I know the DEA is looking at this, but right now that's our current practice here.
Okay.
And we really don't have a lot of that. The one thing that the waste, we've tried to get in different strengths, for instance, of Carpuject to minimize the waste. We started carrying different sizes here. One of the areas that still is a little troubling is sometimes for instance, what's left, the waste for PCAs as well as morphine drips.
She asked a second question, Marion. She wanted to know if you had heard of updates on the proposed universal waste of pharmaceuticals.
Yes, but I do believe that the universal waste, if it goes to universal waste, I believe the only portion that really is going to affect us is it'll be less stringent from the aspect of the manifest, not so much the segregation and sending it out of the hospital, but you won't be required to manifest all the items and have the facility, say they will accept the different types of categories. So I still think there's going to be a need to separate at the nursing level. I just think that the transportation and manifesting is what will be relaxed with that.
Thank you. Lori Fitzgerald asked earlier, why do you continue to list EPI in your P list if it is exempt?
We still list it because we do have epinephrine base in the pharmacy that can be used for compounding. And there has been a lot of controversy back and forth, and we actually, the question comes up, so we just noted it on there that the salts are exempt. Almost every presentation that I have given, some provider has asked, when you show them the list of P-listed waste, it still appears on the list. So we wanted to clarify exactly why it's on the list and which epinephrine constitutes P-listed waste now.
Okay.
But I will tell you we did a whole facility sort, including the operating room and all areas, and we did not find one epinephrine syringe in that sort.
There you go. We have a question about your policies. Mohsen Habib was curious whether you would be willing to share your policy.
We can. If my contact information is on that PowerPoint,
Okay.
if it will be sent out, they can contact me by email.
Okay. And then Linda Sampson asks, would you reiterate nitroglycerin as a hazardous waste? Is it just the patch and the packaging for the patch, not any other form?
Here in Pennsylvania, all I have to dispose of is the patch and the packaging, and the other thing that would fall in there is if you use the nitroglycerin spray, which we don't routinely use here. The spray, because it has the aerosol propellant in it, also falls into that category. We actually had our nitroglycerin tested, and it was below the concentration limits. We collect our nitroglycerin bags. We use premixed nitroglycerin here, which is the 50 milligram per 250 or the 100 milligram per 250. And anything that we prepare, even for the cath lab, we collect in the pharmacy in a separate bucket. It's not hazardous waste, but it goes out to another facility to be incinerated. We have a large 55-gallon blue drum in our pharmacy to collect that.
Okay. John Kleiss says, my understanding is that a product used for its intended purpose can be discarded in regular trash. Can a nicotine patch after use be thrown in the regular trash?
Hazardous waste. I think that's something that you have to make that judgment call on.
Yeah.
I think a lot of the regulations, for instance, I had about 3 questions when I had my visit here from the local, EPA, and it's kind of interesting. They would not give me an answer. They sent me links to the federal regulations. Would not verbally tell me what the answer was, but said they would send me the links for me to interpret.
So there is some interpretation going on here. Yeah.
There is. And so, I think here we've been a little more conservative because the fines are so great and the quantity is so small, it's just not worth worrying about.
That makes sense. Questions are still coming in. This is terrific, and I'm just reading them in the order, so this may bounce a little bit based on, they have more questions based on what you just said, but here we go. If your empty bottle of warfarin is reclosed with lid, does your waste disposal vendor charge for that container as hazardous waste or not? That's from Archie Holmes.
If it's empty.
Well, if he doesn't specify that, he just said, yeah, he does, I'm sorry. If your empty bottles of warfarin is reclosed with lid, does your waste disposal vendor charge for that container as hazardous waste or not?
Because it had contact with the drug, and there's residual on the container.
Right.
Just like if there's a spill of something, all the
Protective equipment.
paper towels or whatever you're using to clean it up has to be disposed of as hazardous waste.
So your vendor would charge for that then?
Yes, we would put that in our hazardous waste container.
Okay. All right, so now Misty is jumping back as a follow-up to a previous question. She says,